could use a transcatheter route and patch each hole individually.
Her heart's the size of a walnut. It's too small to maneuver inside.
A single large patch to close the holes would withstand the pressure?
Yes. It would also block electrical conduction, causing deadly arrhythmias.
Dr. Murphy, did you tell the mom that she caused her baby's birth defect?
No, I said that her antidepressants could have.
Why did you tell her that?
It's the truth.
And is that relevant to her current medical situation?
No.
And how do you think that answer would make her feel? What did you think would happen? The mother is devastated. The father is furious. I would be too.
Shaun is a resident. Residents make mistakes.
Managing these parents' emotional concerns is as much a part of this job as operating on their daughter.
Social cues are hard for Shaun, but we've been working with him.
You should be focused on your own shortcomings, like retaining the formula for vascular impedance.
Dr. Hahn, we could patch each individual hole in the heart if we cut open the ventricle.
Don't change the subject, Dr. Murphy.
I didn't, Dr. Hahn. We were talking about the baby.
Really? You don't see a difference in the nature of your discussion before I arrived and after.
We were talking about the baby.
They tried the approach you suggested at LA Children's. The baby died a week later. The suture line didn't hold and the cardiac wall ruptured. Keep looking. Dr. Murphy, do not talk with those parents again.
I think maybe you should be quiet around Han for a little while.
But then how will I answer his questions?
Direct questions, absolutely answer. Otherwise, outside of the OR, you should stay out of his way.
If someone had convinced Shaun to do that with Dr. Melendez, he would still be on suction.
Code Blue, NICU, bed 4. Code Blue, NICU, bed 4.
O2 sats dropped and central venous pressure shot up.
Pulmonary artery band is failing. 8 of dopamine.
Let's get a mask on her.
She won't last much longer. We need other options. I'll update the parents.
Let's get her on full cardiac support.
What do you got? Anything?
This Cleveland group repaired a bowel protrusion using enterolysis. I could cut out this excess inflammatory tissue and segment of bowel atresia. Might make her intestines small enough to fit.
Promising.
Given the size of her abdomen, I need to remove a lot of bowel. There's a good chance she wouldn't be able to absorb food.
We'll have to find the right balance. It's our only workable plan. Best bet on the heart is to cut through the ventricle, like Murphy suggested.
You were concerned about the suture line holding.
I still am. Hopefully, horizontal mattress sutures will work. They should be able to withstand the tension at the suture line.
There's still a risk of an aneurysm forming in the tissue underneath.
Dr. Lim, I have an idea I'd like to share, even though Dr. Hahn didn't ask me a question.
Yep, go ahead, John.
If we go in through the atrium, we wouldn't have to worry about the suture line.
It's the same issue we discussed. There's not enough room inside the baby's heart to stitch the patches into place.
No, we don't need to, Dr. Hahn. We can make a plug small enough for her heart, a PTFE disc with a stem like a mushroom. Then we can insert the stem through one of the holes until the disc presses against the wall, covering all the holes.
Like a stopper in a bathtub.
Yes. The higher pressure on the left side of her heart would keep it in place.
We wouldn't even need to stitch.
Great idea. We should take this to the parents.
Great idea for the heart, but we need to tell them that our current plan for the abdominal repair is considerably more of a long shot, and that fixing the heart takes an option off the table. Withdrawing care. differential diagnoses are you proposing?
I need to speak to the patient. Should I ask Dr. Hahn for permission?
Shaun, I will bring your concern about the scan to the head of radiology, but approaching Dr. Hahn, don't do that. No, I already talked to him about your reassignment. I don't know if it'll make any difference.
If I were Claire, would you let me approach Dr. Hahn about something that concerned me?
Yes, I probably would.
Is that because Claire doesn't make mistakes when she's communicating?
Yes.
Then do you think Dr. Hahn made the right decision by sending me to pathology?
No.
Hello, Dr. Glassman.
Hi, thank you for coming. He has been doing this for 2 hours.
Shaun? What are you up to?
Alphabetizing our canned goods and checking all the expiration dates.
Well, somebody's got to do it. Is something wrong?
No.
Okay.
Okay, I think Dr. Lim's patient's diagnosis is wrong, but I can't prove it without information, and I'm not allowed to talk to patients.
Shaun.
I want to run with things. I want to fix people. Can you help me become a surgical resident again?
No. I can't, Shaun. I'm not president.
Yes.
I'm not the president of the hospital anymore, Shaun. And even if I was, it's irrelevant. You have to stand up for yourself. And you know what? If you can't, then the new head of surgery, the chief, he's right. Now I can go tell him he's wrong, won't do any good. Or you can go show him.
I'm looking for her sister, Jess.
I haven't seen her. Sorry.
What are you doing? Can you explain why, instead of remaining in pathology as directed, you were in a patient's room, going through her purse?
I didn't speak to her. She was asleep.
Dr. Murphy, any reticence I had about removing you from surgery just vanished. You shouldn't be in contact with patients, or their families, or anything they own. Do you understand, or am I going to be forced to fire you?
Sadie's social media says that she finances her climbing travel by working as a freelance food critic. She reviewed a Japanese restaurant that used to have a restaurant grading system score of A, but then it dropped to a C, which corresponds to very bad food safety practices. Bad sushi can lead to worms, but it usually doesn't because stomach acid almost always kills fish parasites, but not if someone is taking an acid blocker, which 60 million Americans are. I saw a bottle in her purse. Sadie could have sparganosis with an encapsulated worm that is mimicking a meningioma.
That's a good idea.
Excellent. I'll tell the patient.
I will tell the patient. I'll tell her we're doing a biopsy to confirm the initial diagnosis.
But
It will tell us if the initial diagnosis is correct. Your theory is a real long shot. It would be irresponsible to get her hopes up.